The ingot offers two choices, 10 centimeters and 16 centimeters straight segments. My main goal in developing this filter was to better visualize C7. This is how the ingot operates here. By protecting the vertebrae above C7, it is possible to double and even triple the radiation, I mean the MAS rather than the KV, without burning the other vertebrae. But this is not the only means for success. There is a second factor. It is the alignment of the focal spot of the tube that must hit the top of both shoulders. The third factor, and often the most important one, is the lowering of the shoulders. When lifting weights, there is a risk of also lifting the shoulders. Passive traction is much preferable. Again, a low centering. And the ingot. Horizontally, at emergency, as you know, this procedure is of the greatest importance. But be careful, especially when it comes to fractures of the legs, and even to those of an upper limb, pelvis, or spine, which must not be aggravated. After obtaining medical permission, traction may lean on the perineum by means of a bicycle seat at the end of a pole screwed to the board. Thus, the lower legs are completely free. You may see on the left that C7 is better visualized than on the right on account of these three procedures: traction, low centering, and the ingot. Another superb opportunity is the cervico-dorsal portion of a myelogram. On the profile of the dorsal spine, the central part is often over-penetrated. This can be improved by superimposing the ingot. We also realize here the effect of the diverging beam on the wedge. The demarcation is imperceptible when the wedge lies transversely across the beam, as used here. With thin-waisted patients, L5 is too often underpenetrated, since it is hidden by thicker tissues. The area is naturally filled by the ingot, and normal technical factors can be applied to L5. With older and thin patients, the greater trochanter is also too often overpenetrated. The cushion lifts up falling skin. On the lateral of the femoral neck, when the head is nice, the diaphysis is too dark, so the ingot is used here too. The coccyx of thin patients is another area of valuable use.